and start the recording. Reminder, just do everything confidential. Welcome to the October the 27th Board of Health meeting, third quarter. We'll go ahead and call this meeting to order and take attendance. Start. Dr. Ben Anderson.
Here.
Jennifer.
Here.
Julie Beckner.
Here.
I'm so sorry. Oh, I had it all right together. Now I got myself nervous. Yeah, thank you. It's Chad Springer.
Here.
Thank you. Not present. Becker, you're Julie, or no, Denise Strasser. I get that correct?
Mhm.
Okay. We want to approve the minutes for the last board meeting.
Motion.
Second.
All those in favor say aye.
Aye.
All those opposed? None opposed, we'll go ahead and accept the board meeting minutes for the last meeting. We'll go ahead with the division reports, and Randy Myers is going to step up to the podium and give us his report.
Okay, pretty simple. 48 inspections, 3 complaints, 3 operational inspections, 22 itineraries, 46 recalls and advisories. And then, of course, that's the quarter that has every festival in the world. 43-year-old Settler Hispanic Depot Day Bacon Fest. That's it. Any questions?
Any issues with the Bacon Fest?
Nope.
Great. Thank you, Randy.
You are.
Next, we will hear the report from Kevin Fessler, the Environmental Health Specialist.
Okay, we have, I have split mine out per month because the new requirement the state wants to see every month's activities, so. But this quarter, we've had 4, 5, 6 new permits issued, 4 repair permits issued. I've issued 17 minimum specifications. We had 1 complaint. I've done quite a few inspections. But as far as inspections are concerned, usually with each minimum spec, I go out at least once to the property before I issue the minimum spec, just to make sure that it looks suitable. And then I usually go, after the permit's issued, I'm usually out once or twice for each permit. I did 1 site survey for a failure. We've had 17 permit lookups. And we've had 1 follow-up inspection from an old failure that finally got done. And then final inspections for all of the permits issued that have come in. All right, on the environmental side, we only had 1 complaint this quarter, and it was resolved. Had quite a few site visits. And we still have 10 unresolved complaints. I did water samples 3 times for the Pittsburgh well every month. I've done 2 lead risk assessments this quarter, 1 mold inspection, site visits that are coming in. Just a report. Any questions?
On the water samples, any issues?
Were you able to get the water sample testing on the website?
We put up, just put up Friday, Thursday? No, the most recent. We do get calls about that. Yeah.
Any other questions? Thank you, Kevin. And next, we have Jean Randall for the public health nurse report, or Operator Steve.
I'll do the rest of it. So for this quarter, we had 184 total immunizations, 98 patients. And no more antibodies. Good. We have 4 hepatitis C cases. And if you want to look at the extra long sheet there, I printed out, that's the one that I do want back. That has, there's actually, the numbers are slightly off in animal life between this, but I think that's just from the way it's reported from the district level. See for the chlamydia cases, there's 21 total for this year and 31 from last year. So as they investigate the cases, they add them to the previous year as appropriate. So I think the last meeting said 20 last year, and now it's up to 31. That's why that discrepancy for everything in the meeting minutes is. Just as they investigate, they update the records. Any questions with the immunizations?
What happened in second quarter that we had, like, we had 1 animal bite first quarter, 17 second quarter, 0 third quarter? Like, what was going on? Like, were those correlated to something in particular?
I don't, was it a lot of raccoons? I feel like we had more.
Raccoons, bats, a lot of bats.
Yeah.
We had a lot of
of
bats.
bats. Yeah.
Well, there was the story, I don't know if that contributed in the paper, and the comment about bats.
Oh.
Maybe, I don't know.
Yeah,
Might have-
raise some
Yeah,
awareness.
kind of raise some
of-
awareness,
yeah.
people realize if they're in the room with bats, they need to be
People were
reported.
self-reporting more
Yeah.
than they otherwise would. That makes sense. It just seems like a big discrepancy.
Yeah, yeah.
So does that mean there's that many bat bites that are going unreported normally?
Well, it's hard to know. Or did they wake up with a bat?
Right, right.
Well, as far as treatment goes, is it, do you do that at Logansport if, or do you have to send them to like one of the larger hospitals?
Rabies.
Do you do it at Logan, all emergency?
The initial rabies vaccines are usually done in ER, and then the subsequent can be done at urgent cares and outpatient settings. Other questions for this report?
Next, we will have Megan Smith now, right, for our vital records administrator.
Okay, so everything is pretty much there. The one that's a little different in the report is for this quarter, I broke it down by month of how many we got of each thing. Looks like for death certificates, those have gone back up in number quite a bit. That's pretty much it. Anybody have any specific questions on any of the numbers?
Are we seeing people from out of county getting birth certificates? I mean,
Yeah,
Or-
it's a lot more accessible to some people, so yeah. Yep. Thank you. Thank you.
the health officers.
So, I don't know if this report lights on. So just talk extra loud when I hear, because I don't think this thing's working. Our final budget, I have a proposed budget there, you can look at that if you want, that's what I gave to the council. Over our historic funding there, it's broken down, you can see the 22 budget was about $300,000, same as 23, 24 was when the HFI funds started, went up to 560,000, and this year we're at 617. Or we didn't have any changes to our core services, requirements stay the same, but our HFI fund for next year was cut by 73%. So the total funds we had from HFI for this year were 397,000. Next year it's 106,000. So our total 2026 budget's $365,273. I broke it down from the funds individually there on this page. The new initiatives page is the 2026 budget changes. And then if you want to look at the summary page here, I have it all separated by each individual fund and their total amounts. This was approved by the council without any revisions. I think the official vote is later this week, but there were to be revisions for it. It should have been on, came back to us. So it looks like what we asked for is good.
Great job.
Yeah. If you look closely, you'll see the part-time nurse position is not funded there. So talk to Gene, we do have some remaining old grant funds that we can appropriate for next year so that we can add some part-time nurse hours. Because the next item on my list here is the staffing updates. We've had 2 resignations, the liaison nurse roles. Certainly wish them the best in their future endeavors. We do have those positions posted. We've had 5 applications for liaison role, 2 nurses so far this week. I do anticipate needing some continued part-time nurse, which is why I want to appropriate those old grant funds at some point. So that we have some continuity there. Gene's been very helpful in keeping vaccines going and everything else in the public health nurse regard, or area. I do think long-term there may be some changes to the emergency preparedness from the state level. I'm not sure how much that's going to be a focus for them. So we did get $20,000 this year. It had been $25,000. So I think what we've proposed and been approved for is to keep the health liaison role as well as the nurse role as full-time roles. Our intent is to fill that, and as the next couple of years go by, we can see how the state plays out with emergency preparedness and adjust it. We have our total grant funds that we've allocated here. This is the HFI funds. Again, we made a nice breakdown there. We do have the pack in place. We've spent about half of that so far. I'll likely purchase the remaining pack in place in the next couple months, so we're in stock in here. The Zach McGo Foundation, the cardiac screenings were quite successful. I think we had 38 or 39. Total kids, which is a lot more than what they average, and we had good results, I think, for all of them, so it's good. It seemed like people were very appreciative. We just don't have the invoice yet, which is why that spent to date fund is not there. So as soon as that-
worried.
Oh, no, we did it. We did it. They just haven't sent us the bill, so we'll pay it as soon as we get the bill. We still have $3,500 and $2,500 for the swim lessons and A1C funds that we voted on last meeting. The Purdue Extension has several classes there. The Food is Medicine program, you're invoicing us and paying that as it goes. The life facts are completed. school's done, or the police department car seats are $1,000 out of the 5,000, and we're also doing the car seat courses. 2 days last week and then 2 more days this week. And that will also have a lot of grant car seats, so those are a great opportunity to actually save some funds on the car seats. The gun safety classes almost spent up all their funds. Questions on where we stand on any of those?
I don't have a question, but I would like to say thank you very much for supporting our schools, both Carroll and Delphi, in the different opportunities that we've been given. The Nathan Harmon, I thought he was an excellent speaker and really captured the students' attention. Appreciate work with our swimming lessons, and I think, was there another one in there? Oh, yeah, the Zach Mago, I think, or however you pronounce that. I think, like you said, we had some good participation there, so hopefully they continue with that.
The only thing, so I had here, the Purdue Pharmacy Fellow very much wanted to be here, had to teach a lab or something this evening, so unfortunately he was not able to be here. They've done a phenomenal job. He comes out and brings at least 2 pharmacists with him for all of these events, so they've got 3 people that are doing A1C, blood pressures, and education for any of these events. I think we've done 251 A1Cs and blood pressure screenings so far. He was interested in adding cholesterol screening to that as a total cholesterol, not a full lipid panel. That device would cost about $300. I think we're going to need some more A1C supplies before the next Board of Health meeting. So if we wanted to allocate a little bit more of our HFI funds for this year, maybe $5,000, between that and the $3,500, we should have a decent stock of supplies going into next year.
Can we go ahead and take a vote on that? All those in favor of adding 5,000 to use for A1C and cholesterol? Anyone want to make a motion?
Motion.
Second.
All those in favor of putting the $5,000 in for A1C and cholesterol?
Aye.
Motion passed.
So that would bring our total up to almost $59,000 of allocated funds, and that was from $125,000 total for this year. So we still have some leftover funds. With our HFI cuts, my intent is to be able to maintain these programs, extend them through the next several years. We just have to appropriate the funds from the state each time, which is paperwork, but it still keeps the money consistent. The other thing the pharmacist wanted to talk about is STI screenings. It seems to come in waves. We get a few every now and then that call in and want to know if we do STD screenings, and hear nothing for a while. We have not, as far as I know, ever done that. We talked with the division specialist. They can supply basically all the testing equipment and treatment for free, minus the needles for injection. I gave a shot over 7. So very minimal cost to us. It's tracked through the same state system that lead and TB is done, the MBS system, but with STDs, the access to that system is not given to us. So we have to maintain our own internal records. They need to be HIPAA compliant and protected. And then we submit treatment to the division, or positive test results too. We did look at some Microsoft forms that are apparently HIPAA compliant and technically free. I am not super confident in that as a good solution. I think if we really wanted to do this, we would need to consider an EMR. Simple practice, I think the simple practice is about $29 a month for a cloud-based EMR that's HIPAA compliant. So if we really wanted to do that, I think that's the direction we go. If you look at the numbers, it's 22 chlamydia cases for the year. The argument is that number higher because we're not screening? counter argument to that is how many people are walking around with untreated chlamydia? If they're asymptomatic, sure, how many asymptomatic cases are there? And that's the question I don't have an answer to. I think it's worth screening more too, but, we talked about maybe trying to do a mobile clinic, but, you know, if we bring in a semi-trailer that says STD screenings, it's kind of a, we need to combine it with some other events, but it may be best if we just look into offering the screening here. I'm gonna have a full proposal for next board meeting on how much that would actually cost. That looks like we could do it for less than $1,000 a year if the simple EMR really does work that well.
What do some other health departments use? Do they use the simple or?
Some of them, yeah, Tippecanoe has their own, Cass County does not. I'm not 100% certain if Cass County screens or not, or if they partner to do it. There's Practice Fusion is the next cheapest I found, it's $200 a month.
I mean, I think STI screening is squarely in the purview of public health, so I think it would be very reasonable to be offering that. You know, I think for the EMR, it doesn't need to be fantastic EMR, it just needs to be at the front. So I think, you know, if the cheaper one is workable, that would be reasonable.
And you know, what I briefly read about it was that it does offer some scheduling functions that might actually be helpful for all of our vaccines too, because it sends out reminders and makes an interface for us to schedule. So it could be something worthwhile long-term for us to have as long as it's truly that affordable. So that's what I'm gonna look into and bring back for next meeting, but I think it may be very reasonable to do. As far as the actual tracking and managing, it's technically responsible at the division level, so the more we can screen and treat here, the better, but it is being, it's not that we're negligent, it is being tracked on our behalf, just at this district. Other questions regarding the STIs?
Just out of curiosity, because I'm not a doctor, so hopefully you guys can tell me, so is it like 1 or 2 STIs that we're looking for, or is it like 10 or 15 or 20? I don't know what that looks like when you go to testing.
Yeah. I know it's at least chlamydia, gonorrhea, and I believe trichomonas, but I think we had an option for also HIV and syphilis.
I think I was kind of thinking HIV maybe too, so, okay.
I don't think hepatitis was included, but it might have been.
Okay.
And again, that all comes from the district level, so those are not necessarily point of care, but they still have good turnaround.
Okay, thank you.
We looked at some point of care testing, but to get all 5 of those is $180 a test, which would be quite a burden, I think. Another, I just had a look here on boroughs. We've talked about the sewage system in boroughs before. We are making a lot of progress. Kevin's been working with a Masters of Public Health student that's focused on environmental. That's her area of focus. And we've made a tremendous amount of progress. So we're planning to hold a town meeting on November 22nd and present everything. Again, the health department is not, we're not funding any of this. We're just raising awareness and trying to be a guide for how to proceed forward.
Well, that's great that there's progress there. It
Yeah.
takes it's a long process and it started. I mean, that's also,
It's done, yeah, I think everything, and she did a really good job of saving all the documents so that we can replicate that for additional, because there's pretty much every small town.
She really did a wonderful job.
Yeah.
who is the she?
Sarah Tyndall through IU. I've done as much as we can to make some academic partnerships here, because they have been very beneficial and resourceful without costing us labor hours.
And we're very thankful for the Purdue student,
Yeah.
for the pharmacy student. Yeah, so.
They've been phenomenal. They're very motivated, and they bring out a whole team. They frequently bring one of their, faculty members with them, and I think the community has certainly enjoyed it and benefited from it, because they really engage, have great discussion. Other questions from that?
Do you need anything else from us as far as the STI screenings, or just, you're gonna come back with a proposal? Any new matters, any new concerns for the board?
We do have two Board of Health members, and the term's gonna be ending in December. Commissioner Strasser and Dr. Anderson.
I'm out, I'm done.
Do you wish to?
I
Board?
can continue.
And then when do we vote on that?
We didn't vote on it at this meeting.
This meeting?
Yes, because I have to send it
Okay.
Do we know if he's supposed to stay on or?
that I am not sure. I'm gonna have to go back. Yeah, we can vote on it next.
So we can talk to her.
Yeah.
Find out for sure. If you're hearing you want to vote on prison members,
Everybody's okay with that, we'll go ahead, I'll make a motion to go ahead and vote for Dr. Ben Anderson to serve another term on the board.
Let's look at that.
All those in favor, say aye.
Aye.
All those opposed? Motion passed. Dr. Ben Anderson, thank you for your service and continue.
Mm-hmm.
Anything else? Our next meeting will be January. The calendar and see, 6 p.m. What date? Either the 12th or the 26th, likely. You're probably out of office are you out in Martin Luther King Day on 19th?
Martin Luther King Day,
No, I don't think.
isn't Martin Luther King Day celebrated over the 4th of July?
I have no idea.
they clump something together.
They do, yeah. So maybe. What do you think?
Pretty open, so whenever.
What's that?
I'm good with the 26th.
26? I'm good with the 26. Oh, wait, let me think about that. Yeah, 26 is fine. Okay, 26 at 6 p.m. Location will be here in the Commissioner's Room, 6th floor. And at this time, as long as no one has anything else, we'll go ahead and adjourn the meeting. I'll take whoever wants to make a motion.
I'll make a motion.